Okay, so let's talk about tuberculosis a bit, which is an infectious disease of the lungs caused by Mycobacterium tuberculosis. Okay, so how is it transmitted? Through small droplets, so we'll call airborne route, right? So it's from people coughing and releasing Mycobacterium into the air. Okay, and then once it's inhaled into a lung, it actually forms these granulomas of infected tuberculosis. And then other cells kind of try to surround it with inflammation. Okay, so often we'll see them as these round nodules on chest x-ray. Okay. Most of the people that have been in contact with someone with TB, um, most people won't develop active TB. They may develop latent TB, meaning they've been in contact with someone with tuberculosis and they'll test positive when we do a skin test for tuberculosis, but they won't have any symptoms. So that's called latent TB. A small percentage of those people will then develop active tuberculosis. Okay? Remember, tuberculosis typically affects the lungs, but can actually spread to lymph nodes, kidney, adrenal glands, and infect those organs as well. Okay. Now, anyone who lives in a high-risk situation should have annual TB skin tests, right? So, for example, family members of a patient who has tuberculosis should be screened for latent TB. Even if they don't have symptoms, they might have latent TB, and we treat latent TB with isoniazid. Okay, so who else would be at higher risk for TB? So patients that are coming from developed countries or from countries that are endemic with tuberculosis, they're at higher risk for either having latent TB or active TB. Okay, so when you get TB, it's typically a slow onset. Okay, and often it's latent for years. You don't have any symptoms. But even when you do develop it, it's typically a slow onset of coughing, some shortness of breath. You might start to lose weight. You're not hungry anymore. Coughed up a bit of blood, some night sweats, chills. It's becoming a chronic respiratory condition. Okay. What else can I tell you about tuberculosis before we move on? I think just to remember that most people that are TB positive are on skin test. Remember, they don't have active TB, they have latent TB, and they have a chance of developing active TB as they get older, or if they were to become immunocompromised. Okay, let's just talk about some risk factors for acquiring TB. So definitely frequent and close contact with patients that are not treated. Okay, so so family members of someone with active TB, not latent TB. You're not contagious if you have latent TB. Okay, patients in a homeless situation where they're going to homeless shelters, crowded conditions, increased risk of TB. Immunocompromised patients, chemotherapy agents, HIV, bone marrow diseases, diabetes. Anyone who's having to take immunosuppressant drugs is at risk for TB. Areas that are extremely crowded, such as prisons, long-term care facilities that have a lot of people aggregated together. Advanced age is a risk factor for developing active TB, especially if you had latent TB, and then your immune system starts to get weak and you develop active TB. Traveling outside of the United States to endemic areas so parts of the world that have a lot of TB. Immigration into the US from a number of countries that have tuberculosis. Okay? And of course, healthcare occupations. That involves treating patients, especially with respiratory disorders. Okay? So this slide is showing you, well, first it's mentioning that tuberculosis is through aerosolization from infected patients with active TB, right? And it's airborne. So, so early detection is really important because we can pick up patients with latent TB that have no symptoms and early TB as well, right? So people living in high-risk areas and all those risk factors that I mentioned to you, people living with members, people living with someone who has active TB should be screened. So when someone is screened, it doesn't mean they have any symptoms, right? So the screening is the TB skin test. And if it's positive and you don't have symptoms, well, you have latent TB. You're not infectious, but you may benefit from receiving isoniazid to clear the latent TB, okay? Because it can become activated later in life as the immune system starts to weaken, okay? So the symptoms at the bottom, we've already spoken about. All of those are extremely common symptoms with tuberculosis, okay? Now, when we're talking about testing, there's a couple of tests, one on the sputum and one in the blood that gives us rapid results. So there's one called a nucleic acid amplification test, and we get a good sputum sample, and we can test within the sputum if there's any evidence of tuberculosis. Okay, so, and a result can come back very quickly, within hours. Okay. The quantiferon TB Gold test is a blood test. And what are we looking for? Well, it's a test that we take, and we're looking for evidence of tuberculosis, whether it's active or latent. Okay. Now remember, not everyone can give a sputum sample, so the first test may not be possible, a nucleic acid amplification test. You need to be making phlegm. Okay. The other one is a blood test, so latent or active TB can be checked for. Acid-fast bacilli test is a test where we're going to get a sputum culture, but it can take a long time for the tuberculosis to grow. Now, someone who has an active, acid-fast bacilli culture from a sputum sample typically will have active infection. Okay. Again, it can take weeks to obtain the results. So we get early morning sputums, and we send them off to culture. I mentioned that tuberculosis is a slow-growing mycobacterium, so we don't get results for weeks. What about the TB skin test? So this is really a screening test, right? So typically, someone who's been exposed to tuberculosis, they're typically going to have a positive TB skin test, which is a little intradermal injection of tuberculin, in the range of weeks to months after their exposure, right? So what we do is we inject a bit of the tuberculin on the inside part of the forearm, and we wait and read it 48 to 72 hours later, 2 to 3 days later. And we're looking for induration, meaning raised skin, the area, the circle of raised skin, not the redness. It's the circle of raised skin. So an induration of 10 millimeters or more indicates a positive test usually. Okay. In immunocompromised patients, we accept 5 millimeters of induration because they don't mount the same response. So even 5 millimeters is enough to call it positive if you're immunosuppressed. Okay. So what does the MAN2 test tell us? It tells us that the patient has developed an immune response to TB in the past, and we're picking it up by the TB skin test. It doesn't tell us if there's active TB. That would be based on symptoms. Latent TB doesn't have any symptoms. It just means that it's living in your body. Okay? Now, a patient who's had a TB vaccination in the past called BCG, Bacillus Calmette-Guerin vaccine, they've had the vaccine and now we're giving them a TB skin test. They may respond and get a positive TB skin test based on the fact that they had a vaccine years ago. Okay, so it may not be very useful to do a TB skin test on someone who's had the vaccine in the past. And then we just go to a chest x-ray or a blood test. Okay. Some patients that are severely immunocompromised just don't generate a positive result even if they have latent TB in their body, because they're so immunosuppressed they don't respond to the tuberculin that we've injected under their skin. Okay. Just making sure I cover some of the points here. Okay. So we often get people returning to have their TB skin test read 2 to 3 days later. Okay, so they've had it done, they return, and then we see if there's a response. If we see there's a response, we'll measure it to see how much of induration is there. Remember, it's not the redness, it's the induration. Okay, so I'll just continue talking about tuberculosis diagnosis. The MAN2 skin test is what we were just talking about. It's intradermal. It's read 48 to 72 hours after the injection on the inner forearm, and it's measuring the induration. Okay, 10 millimeters positive. If you're immunosuppressed, we'll accept 5 millimeters. Okay. The quantiferon TB gold blood test we spoke about. Let's go on to chest x-ray. So chest x-ray would be for someone who had a positive TB skin test. Okay, that doesn't tell us anything about whether it's latent or active. It's just one of them. They tested positive. We can go on and have a chest x-ray to see if there's any signs of active tuberculosis in the chest. Okay, the acid-fast bacilli I mentioned, that if it's positive is really suggestive that you are growing mycobacterium in your sputum, and that's suggestive of active disease. Okay. Now, just as a reminder, there are some patients who are going to either be immunocompromised, so say HIV patients, or they're going to receive treatment that's going to make them immunocompromised. And there's many drugs that can make you immunosuppressed. So often a TB skin test or a TB test is required before receiving the treatment to see if you have latent TB that could become activated from the treatment. Okay, this slide I won't spend too much time on. Heated and humidified oxygen therapy for tuberculosis, airborne precautions, since it's an airborne transmitted disease, so negative pressure room, an N95 respirator. Patients will have to wear a mask when being transported out of the room. Adequate nutrition. Why? Again, because the body's treating an infection, right? So you need proper nutrition. Okay, I think that's all I'm going to say on this slide. We'll just keep on moving because I know there's quite a few slides left. Okay, so let's just look at this slide for a bit. So the importance of educating the patient on taking their medications regularly and the same time each day, especially regularly, right? You're trying to treat an infection that's requiring sometimes 3 or 4 drugs. And that's because tuberculosis is becoming resistant. So if you're not taking your medications regularly, it's going to give the tuberculosis some time to start to reactivate and grow and divide again. Okay, so really important to adhere to the medication regime. Wearing a mask in public areas. Otherwise, if you have active TB, you're going to be coughing mycobacterium onto surfaces and potentially infected other patients. Reporting of jaundice, because a lot of these tuberculosis medications are hard on the liver, right? And it can lead to jaundice. And that's why we don't recommend alcohol use either, because of the risk of these drugs causing hepatitis, and of course, alcohol can cause alcohol hepatitis, right? Often the length of time to treat tuberculosis is 6 to 12 months, even up to 2 years with resistant tuberculosis. Okay, so in terms of the medications, why do we combine 3 or 4 medications for active TB? Because of increasing resistance, right? And it takes a long time to treat tuberculosis, 6 to 12 months, right? So non-compliance is a really big problem, and it can create resistant tuberculosis strains, okay? So the typical, 4 drugs that are combined: isoniazid, rifampin, pyrazinamide, and ethambutol. Okay, and in the book, it'll give you some important information about each drug. Just to say, isoniazid is the drug that we typically use for latent TB by itself. Okay, so a patient will take isoniazid. They don't have any symptoms, they test positive, so they have latent TB. And what we want to do is prevent developing active TB later. What's the main symptom of isoniazid? They can develop a peripheral neuropathy. Okay, it says neuritis there, that's a bit of an odd term. So peripheral neuropathy. And we can reverse the peripheral neuropathy with vitamin B6. Okay? Which is also called pyridoxine. So isoniazid is a very important drug because it's part of treatment of active TB, but also it's the drug that we use for latent TB as well. Okay, it's also hepatotoxic. So not only can it cause a peripheral neuropathy, it can cause hepatotoxicity as well. I would just choose the main side effect of each drug and remember it. Isoniazid, peripheral neuropathy, and hepatitis, right? Let's look at rifampin. Rifampin, it's going to turn your urine orange, and it can also cause a hepatitis, okay? So orange, yellow with rifampin, and the potential for hepatitis. Okay. Pyrazinamide, what can that do? Well, it's hard on the kidneys, right? And it can also cause gout. So, we check. It's hard on the liver and the kidneys. So we check for hepatotoxicity with pyrazinamide, and we can also advise on the fact that it can increase the incidence of gout. Okay, and ethambutol, the main issue there in terms of adverse effects is vision. Okay, so they'll need visual acuity tests, and they'll need follow-up to monitor for reduced vision. Okay, so every drug, there's going to be 1 or 2 side effects that you should probably just keep in mind. Streptomycin, it's going to be ototoxic, so I would think of that. Well, it is an aminoglycoside. Aminoglycosides in general are hard on the kidneys and hard on the ears. Okay, so that's why they're mentioning ototoxicity here. Okay, so let's just briefly talk about client education and we'll do some questions. So TB is definitely usually treated in the home setting with follow-up. Airborne precautions aren't needed in the home because everyone's already been exposed, right? So there's, it's not like everybody has to wear a mask at home. Okay, family members should be screened for TB, and if they have latent TB, they can be offered treatment with isoniazid, right? Treatment is usually 6 to 12 months. They need to monitor for symptoms of hepatitis, such as anorexia, nausea, jaundice. Sometimes they need to be treated up to 2 years for multi-drug resistant TB. Not taking your medications regularly will result in resistant strains of TB. Okay? Sputum samples are usually needed typically every 2 to 4 weeks to monitor for drug effectiveness, right? And if you no longer are culturing any mycobacteria in the sputum on 3 consecutive visits, then you are assumed not to be infectious any longer. Okay. I think that's it. Wearing a mask in public places is always a good idea. Now let's go to complications. Miliary TB just means that the TB has spread from the lungs elsewhere into the body. Okay, so it can spread to multiple areas of the body, lymph nodes. It can spread to the kidneys, all over the place. So that's all miliary TB is. Okay, so and the treatment would really be the same as for respiratory TB or pulmonary TB. Okay, let's look at the questions here. A home health nurse is teaching a client who has active tuberculosis and is following a medication regime that includes a combination of isoniazid, rifampin, pyrazinamide, and ethambutol. Which of the following client statements indicates understanding? I can substitute one medication for another if I run out. No, that's a bad idea. That's not going to help with fighting resistance. I will wash my hands each time I cough. Absolutely, because you may have mycobacterium in your hands now. I will wear a mask when I am in a public place. Very good idea to avoid spreading the disease. I'm glad I don't have to have any more sputum specimens. That's not true. They typically need sputum specimens every 2 to 4 weeks until they're not infectious. I don't need to worry where I go once I start taking my medications. No, you have to be shown to be non-infectious first, right? So until then, they should be concerned about where they go. Okay, so the answer is B and C. Number 2, a nurse is teaching a client who has tuberculosis. Which of the following statements should the nurse include? You will need to continue to take multi-medication regime for 4 months. No, it's typically longer than that, 6 to 12 months, up to 2 years. You will need to provide sputum samples every 4 weeks to monitor the effectiveness of the drug. That is correct, because we want to see if the sputum cultures become negative, right, which is a good sign. You'll need to remain hospitalized for treatment. No, you can go home typically with TB, unless you're very ill. You'll need to wear a mask at all times. No, you won't. In particular, at home, you wouldn't need to wear a mask. A nurse is caring for a client. So number 3. For number 2, it's B. A nurse is caring for a client who has a new diagnosis of tuberculosis, has been placed on a multi-medication regime. Which of the following instructions should the nurse give the client related to ethambutol? So this is where you should know about your adverse effects, right? So the first one, dark orange urine, that's going to be rifampin. Watch for a change in the sclera of your eyes. Well, that could be a lot of them, right? Pyrazinamide, isoniazid, not so much ethambutol, okay? It's going to be vision somewhere. Watch for any changes in vision. There you go. That's ethambutol. Take vitamin B6 daily. No, that's isoniazid. Okay. So it's C. 4, a nurse is preparing to administer a new prescription for isoniazid to a light-skinned client who has tuberculosis. The nurse should instruct the client to report which of the following findings as an adverse effect. You might notice yellowing of your skin. Okay. So isoniazid does have the potential for causing jaundice, so I'm not sure why they didn't mention that. They've put that one. You might experience pain in your joints. No, that one's not. Which drug are we looking at here? Isoniazid, yeah. So, so B, that one's not accurate either. You might notice tingling of your hands. So there's the peripheral neuropathy of isoniazid. Okay, so C is correct. I still think A is fair though. And D, you might experience a loss of appetite. I think that can happen with any drug, so I don't really see that as a fair statement. So the most the one that's closest to the truth, and the one that's definitely accurate, is tingling of your hands, paresthesia. But you can get some jaundice with isoniazid, so I think A is also correct. So, yeah. Number 5. A nurse is providing information about tuberculosis to a group of clients at a local community center. Which of the following manifestations should the nurse include? Persistent cough? Absolutely. It's a chronic persistent cough. Weight gain? Nope. They're losing weight. Fatigue? Absolutely. They're fighting an infection. Night sweats? Absolutely. Right? They have an infection, they're developing fevers, in particular at night. And purulent sputum? That can definitely happen with tuberculosis as well. So, okay, so it's A, C, D, and E. Okay, let's move on.